This is 74-year-old Albita Maruri. 3 weeks ago, she was supposedly cremated after reportedly dying in hospital from coronavirus. But now, her family's been informed she's still very much alive and that they have the wrong ashes. This isn't the first case of mistaken identity in Ecuador's chaotic COVID-19 epicenter of Guayaquil. Nationwide, the number of confirmed cases has doubled.
This is not because the cases appeared overnight, but because all the backlogged tests were processed and reported yesterday.
In Ecuador, no one can really say how many people have died from COVID-19. Only that people are dying faster than they can be properly tested and identified. A nurse who doesn't want to be named says that in his hospital in Guayaquil, he's had to pile up bodies in the bathrooms because there's no more room elsewhere.
That's very traumatic for us. Imagine, I have nightmares. I'm not very well psychologically. We can't do more for a critical patient than give them saline solution when what they need is a ventilator.
In Brazil, it's a similar case. This is the Nossa Senhora Aparecida cemetery in Manaus, the gateway to the Brazilian Amazon. Even some of the gravediggers have died after contracting the virus in the desperate race to bury victims. Luigi Paolo just lost his mother-in-law, whom he says could not access emergency care.
A person who needed to be in an intensive care unit was in a basic hospital bed where they didn't even have x-rays. It's a horrible film. I never expected to see this in my life.
Hospitals are reaching their capacity even before the expected peak of the pandemic. Malaria and yellow fever are already widespread in this region, where communities along the Amazon River are days away from the nearest hospital. Now, Manaus has the highest mortality rate from COVID-19 in all of Brazil, a sanitary emergency that's become a calamity. Lucia Newman, Al Jazeera.